Dr. Lyndon McGill here at the Spine Clinic in Salem, Oregon. Today I'd like to talk to you about osteoarthritis, a condition we see a lot here at the clinic. I'd like to discuss some of the treatment options we have available here, as well as some things you can do at home to get some relief and then perhaps even slow the progression of this debilitating condition. Osteoarthritis can strike nearly every bone in your body, but it's seen most often in the movable bones such as your spine, hips, knees, shoulders, and hands. In these areas, osteoarthritis usually shows up where the joints have lost their fluid and the bones are closer together, perhaps even rubbing on each other. Here's an example of osteoarthritis in the hands. Note the loss of the joint space circled in red and the increased whiteness of the bone on the X-ray, which means the bone is more dense. In this case, the increased density is the osteoarthritis, or thickening and roughening of the bone. So, if osteoarthritis begins to occur due to a loss of joint space, what can we do to reverse this effect? That's correct. Increase the joint space to allow more fluid to return. The body doesn't like a vacuum, so it tends to fill it with fluid, and in this case, joint fluid. So here's a little trick I came up with for patients suffering with arthritis in their hands. You've probably seen these before. They're called Chinese handcuffs. You can order them online from Oriental Trading Company or from Amazon. Simply slip them on your fingers and then pull your fingers apart, applying a nice gentle traction of the joints. And you can sit there and do this while you're watching TV, for example. You do it for all your fingers and then your thumbs. Now, if your osteoarthritis is pretty severe and you need more immediate relief, we offer galvanic ultrasound therapy here at our clinic. We simply immerse your hands in water and lower the sound head in as well, which transmits the galvanic current and ultrasound simultaneously through the water. For the spine, such as the neck shown here, the same thing occurs. The disc between the vertebrae can deteriorate or lose their fluid, and the vertebrae get closer together. It results in osteoarthritis and bone spurs. To reverse this process, we have you begin doing cervical traction at home with a home cervical traction unit, such as the one shown here that we have available at our clinic. We have you do this twice a day for 10 to 15 minutes using just a light, gentle traction. If you pull too hard, the muscles will actually begin tightening up to resist, and you will be defeating the purpose, so go lightly. The cervical traction unit is effective down to about T4 in the upper back. Osteoarthritis can also occur in the lower back, as shown here with spurs and disc degeneration, in the hips, a normal hip on the left and then a degenerated hip on the right with spurring, and also in the knees. Again, the normal knee on the left with plenty of space, and then on the right, the bad knee with the joint space deteriorated and spurs forming. And if you have deterioration of the lower back or the hips and knees, we recommend purchasing an inversion table from Big 5 Sports or other retailer for around $100. Once assembled and adjusted for your height, simply step onto the foot pegs, secure your ankles, and then tilt the table back so that your head is tilted about 20 degrees downward. Don't hang totally upside down. That's way too much pull on your muscles, and they will actually react by tightening up, thus compressing your joints even more, defeating the purpose. So never tilt more than 20 or 30 degrees. We recommend starting at 3 to 4 minutes, then gradually adding a minute or two every few days until you can work up to the maximum of 15 minutes. We recommend doing this twice a day, morning and night. Hopefully this video has been helpful. If you're suffering from osteoarthritis and need some immediate relief from your pain, give us a call. We'll be glad to help.